On March 5, 2020, the Faculty of Medical Sciences Teaching and Research Complex, the UWI Mona campus, held a conference entitled COVID-19 Pandemic Preparedness. Speaking on international perspective is Professor Peter Figueroa.
I'm going to just try and touch on some key points as we go through. The first is, my understanding is the novel coronavirus is now named SARS-CoV-2. Okay, so that's the virus, the name of the virus. And the disease is COVID-19, right? So coronavirus, COVID-19 for the year. Okay, now, this is not the first time we've been through the challenge of an emerging disease, right? We've been through all of this before, and nearly all of us are still here, right? Right? We have managed this before. I have forgot to put in cholera in the early 1990s, right? Now, going back to AIDS, only some of us were there. And there was a lot of discomfort and fear, including among health providers. Health providers have an added responsibility. We are trained, and it is our responsibility to be on the front line, helping people. But the first way we help people effectively is by empowering them to understand what we are facing, to help us prepare better. And when it comes together, we deal with it calmly, systematically, and without fear or irrational behavior. The more we work together, the better we do it. So I'm just reminding us, some of those are serious diseases, some are more serious than others, and we've managed it. And there'll be more in the future. I've put on one side what often happens. People get alarmed, fearful, they start blaming somebody, including the people who have the infection or disease. We're still doing that with some diseases. It's not the correct approach. We then shun, discriminate, stigmatize, and a lot of irrational behavior. What we should be doing is, of course, expressing concern, because that activates us to investigate, respond, help, prepare, study it, plan, and manage it better. Unfortunately, we have a saying, familiarity breeds contempt. We are so familiar with the flu that we take it for granted. Every year, millions of people get infected. In the United States, an average of 30,000 people die from the flu every year. And nearly 500,000 people die globally. And yet people pay no attention to the flu. We should be taking the flu vaccine. It's only 40 to 60% effective. But because so many people get infected, especially those at risk, the elderly, the very young, and the pregnant, should be taking the flu vaccine at the beginning of the flu season. And that would reduce the number of hospitalizations and the number of deaths. So let us bear this in mind. Most of us are quite calm if a family member has flu. So we can be calm if a neighbor or friend or family member gets COVID. We can remain calm. Just get active and do what you need to do. So I've just put up the 4 countries. China, Well, let's go straight. It's more than 60 countries. This is 24 hours later or something. It's 85 countries, nearly 100,000 cases, over 3,000 deaths, death rate of 3.4%. But you notice it varies among the different countries. The case fatality rate, 3.7 in China, but as high as 7% in the United States. But look at South Korea, under 1%. Maybe, different things are going on here, and we don't have much time to go into all of it. But in South Korea, they did aggressive testing. They actually had drive-by testing, where people could drive up and health providers would test them while they're in the car. It's a good idea. Not everybody will be driving, but some people could drive up, get tested. In London, instead of putting the person in an ambulance and taking them to a facility, they made a technician go to the home, take the sample, and bring it to the lab. Because every time you put someone who is ill into the ambulance, you then have to disinfect it and clean it. And it's out of commission. So we have to think creatively and learn from others. So in the United States, this is now why I put the United States up there is because they've not done that much testing so far. And that may explain why the number of deaths, although just 9 so far, it's 7% of cases. In other words, there is an underestimate of the true number of cases in the United States. And what tells us that is in places like California, they say, well, there was community spread, which means they've not identified all the contacts. And very often in situations like this, when a lot of people are getting infected, not everyone who is infected or ill is going to be tested. So you undercount the number of confirmed cases. So the death rate is going to be lower than what is usually quoted. Now in South Korea, there was a 61-year-old woman who was a member of this church. She was ill. She was offered a test and she refused it. And it ended up where there was a chain of transmission. And one view is that over 400 people were infected. So if we recommend that someone be tested, it's just logical that they take the test. So we know that it's COVID and not some other condition. The severity of cases may reduce with time. If you compare in China, the onset of cases in early January with early February, you can see there's a significant difference in death rate between 15% in January compared to 0.8% in February. Now, China has mitigated the epidemic. They have reduced transmission by having an unprecedented response. And we must ask ourselves, would we support the government in our country doing an unprecedented response? As Celia said, 60 million people were put in quarantine. They locked down Wuhan. Places of work were closed. Schools were closed. People were quarantined. It appears to have definitely slowed the epidemic and allowed us more time to prepare better. So I just want to reflect very briefly. We are still learning about SARS-CoV-2 and COVID-19. The transmission dynamics are not fully clear yet. We're still understanding this thing as it develops. The reported cases are likely to be an underestimate of the true number, and therefore the case fatality rate is lower than what we are hearing. Now, I personally feel that we've got to now improve communication with the health providers. There need to be regular emails going out to all the health providers, both in the public and the private sector, with very, very clear guidance on what advice we should be giving to patients, as well as what measures you take if we suspect a case. And similarly, we must speak with clarity to people in the public, everybody. And this is what I think we should be saying. Think as an individual, first about yourself and your family members, your neighbors, your friends, and the population as a whole. Dr. Karen Webster Carr has to do projections for the population as a whole, and she was doing worst case scenario, and that has to be done by the ministry. But let us take it down to each individual. The individual risk is low. If you look at the age range, luckily very few children are getting infected, right? So don't panic about your children, right? Very few children. Young adults, few young adults are being affected. The people who are primarily being infected are those who are the elderly, the older people, right? But especially those with comorbid conditions, cardiac conditions, and diabetes, other serious illnesses. So we need to be thinking then about our older relatives, our parents, the older people primarily. Most of us, if we are healthy, we are at low risk. Let's develop that further. All of us, from now, should be avoiding persons with respiratory symptoms. But you may have a family member with respiratory symptoms. So you still have to live with them. You cannot throw them out of the house. So you work out how best to manage it in the house. Think about it and work it out. Professor Wendelabel has gone through all the personal measures, the hand washing, the touch. Now, if it's good if we have tissues, so we can cough into tissues and sneeze into tissues, discard, and then wash our hands. If we don't, we can do the elbow thing. But even if someone gets infected, most times you're not going to get a severe infection, right? But you need to stay home. You may even need to be quarantined. You may need to do a test, and they may need to quarantine you. But most times you're just going to recover. It's the minority who are going to be admitted to hospital. And again, even if someone is admitted to hospital, the majority will recover and can be discharged. So we really have to stay calm about this and prepare properly. That is my message to all of us. Thank you.